Hi guys, welcome. My name is Dr. Michael Awua Mensah, also known as Dr. Awua on social media. Welcome to my YouTube channel, Dr. Awua TV. I'm starting this new segment called 21 Questions with Dr. Awua. This is actually the first episode you're watching, and it's a series of episodes where people send in questions. They tell me about their problems. They tell me about their experiences when it comes to oral health. It could be anything, even aside oral health, anything they want us to discuss, anything bothering them. We talk about it on this channel, and we try as much as possible to find solutions to them. So I titled it 21 Questions with Dr. Awua. So it's mainly 21 episodes in one season, hence 21 Questions with Dr. Awua. And this is the first episode. So before we start, I want to give big shout outs to two main sponsors of this episode. That's Lens Vision Opticals. Lens Vision has been supplying me with amazing glasses for the past 2-3 years now. And I would say they've really got their business on a very high pedestal. I'll really give them their flowers. Thank you so much for these really amazing glasses. And the second shout out, or my second sponsor for this episode, is Trax Wear. So they are the manufacturers of this beautiful scrap top that I'm wearing. Check them out. I'll drop their links in the description of this YouTube channel. Please check it out. And if you have any questions at all, don't hesitate to let me know. Good. All right. So in today's episode, I have a question from what's the name? Oh, from Abena. Yes. So Abena has this question. So I'm going to read out the question to you, and we're going to talk more about the solutions for Abena's problem. So Abena sent me a message saying, "Dear Dr. Awua, I've been pondering a most perplexing dental dilemma. Should I embark on my morning routine with a vigorous toothbrushing session, or should I wait until after I've fortified myself with a hearty breakfast? I've heard conflicting theories, and I'm hoping your wisdom can illuminate this dental quandary. Some say that brushing before breakfast ensures a squeaky clean mouth to greet the day's culinary adventures. Others argue that brushing after eating helps to dislodge any food particles that may have lingered after my meal. I'm eager to hear your professional opinion on this matter. Should I rise and shine with a minty fresh smile, or should wait until after I've satisfied my appetite? I'm awaiting your enlightened response." From Abena. Yes. So Abena wants to know if it's important that she brushes before breakfast, or she should brush after breakfast. I know some of you are also experiencing the same issue. Some of you wake up in the morning. In fact, the night before, you don't brush your teeth. You don't brush your teeth. You wake up in the morning, you head into the kitchen, you make some cereal, and you're eating. I mean, how? Why don't you brush at night? You wake up in the morning, you just pop something in your mouth. Others too, in the mornings, you eat everything. Some of you wake up very early to do akple. I know you. I know you watching me, yes. You wake up very early in the morning to make akple. You do the akple, finish eating the akple. Quickly, you head to the washroom to go and brush your teeth immediately after eating. You know, there are two sides to the story, but I'm going to explain to you what is right and what isn't right. First of all, before we delve into that, I want to show you some of the items I use to keep a very good oral hygiene. First, you need a soft bristle toothbrush. A soft bristle toothbrush. I didn't say hard, Kofi. I didn't say hard. I said you need a soft bristle toothbrush. The reason why it's not advisable to use a hard bristle toothbrush is that the hard bristle toothbrush, it causes a lot of wear on our teeth. So if you look very closely, you know, these teeth look really big, I know. So if you look closely, we have the gums and you have your teeth. You're not just brushing your teeth. In the process of brushing your teeth, some of the bristles get a little bit underneath your gum. So if you're using a very hard bristle toothbrush, Daniel, what is going to happen is that you're going to cause a lot of wear on your gum. You're going to push your gums away from your teeth. In the process of using a hard bristle toothbrush too, you're going to cause a lot of wear at the necks of your teeth. I call it the necks of your teeth because that's the part of the teeth that you see before you see your gums. So you end up having a lot of wear along those areas. So people who use the hard bristle toothbrush over a period of time, they'll come to the clinic complaining to you that, Doc, I'm having sensitivity of my teeth. Doc, when I drink cold water, my teeth hurts. Some people will tell you, it's shocking me. Your teeth shock you whenever you take in cold water. The likely cause could be that the gums have receded from your teeth as a result of the texture of your toothbrush, or you have wear on your teeth, mainly due to the technique and also the texture of your toothbrush. So as I said, you need a soft bristle toothbrush. Aside the soft bristle toothbrush, bear in mind that this brush, you don't use it forever and ever. Some of you, the whole year. Come on. The whole year. You use this brush till thy kingdom come. Till thy kingdom come. No, you don't do that. You make sure that you change this brush. You change this brush every 3 months. At least every 3 months. Some of you wait till the brush looks like this. It is curving. One is to the left, but the other side is to the right. But you still be using it, thinking it's a fufu pestle. No, you don't do that. Make sure you change it at least every 3 months. Or if you realize that the bristles are fraying before the 3 months, you change it before the 3 months. So that's about the brush. And even aside that, there are certain brushes that have this unique texture at the back. So aside the bristles you have in front, at the back, you have this rough texture at the back that is used for the tongue. So for those of you who don't know, those projections at the back of the toothbrush can be used for your tongue. All right. So aside the toothbrush, you need a fluoride-containing toothpaste. Not just any toothpaste. You need a fluoride-containing toothpaste. There are so many toothpastes on the market. Some contain fluoride, others don't contain fluoride. But as a dental surgeon, I always advise my clients to use a fluoride-containing toothpaste. And one of my advice too is that you don't spread a lot of toothpaste on your brush. Some of you, when you pick your toothpaste, you spread it all over. Let me show you. You spread it all over, You spread it all over your toothbrush. It's not done that way. It's really not done that way. You're not supposed to spread a lot of toothpaste on your toothbrush. Now, would you go so as a design? Would you go so say as if you're putting icing on your toothbrush? No. Ideally, you need a pea-sized amount of toothpaste. You need a pea-sized amount of toothpaste. This is even too much. This thing you're seeing here, I believe it's too much. You need something small. I'll tell you, this is fine. I actually use this amount of toothpaste. This is fine. You need a pea size. You don't need that much. It's wastage. And even aside that, when you realize that you're using a lot of toothpaste, your mouth, you have all this foamy paste in your mouth, and you believe that because you have a lot of foam in your mouth, you brush your teeth very well. No, that's not the case. You shouldn't be using that amount of toothpaste. Just a pea size is fine. Aside that, you also need to floss your teeth. So there are two types of floss. In fact, there's also a third one we call the water flosser. We'll talk about that in our next episode. But there are two types of floss. We have the conventional or regular floss, and then you have the floss pick. I know most of you are familiar with this one. Yes, I do. Most of you are familiar with this one, but I'm going to show you the types. So this is what we call the floss, the regular floss. You need just a little, arm's length. There's a metal at the end of the floss. So place the string there and then pull it, and it tears easily. You wrap this floss maybe along your middle finger or your index finger, but I prefer to wrap it along my index finger. Hold it. You go in between the teeth. Let it wrap one side of the tooth. Let it hug it, and then you drag it down. Go in between again, same space. Let it hug the other side, and then you drag it down. So it looks like this. Simple. You do that for all the spaces in between the teeth. Lots of you don't floss. I don't know why. Whether it's the difficulty in purchasing floss, or it's the laziness, or you just don't know how to floss. Flossing should become a routine thing for you. It should be something you do every single day. Every single day you need to floss. My brother, my sister, you need to floss. And this is also the floss pick. So just like the regular floss, it goes in between two teeth, it hugs one side of the tooth, and then you drag it out. Goes in between two teeth, hugs the other side of the tooth, and then you drag it out. That is how to use a floss pick. I'm going to demonstrate that to you. And you drag out. So it cleans all the food debris, because trust me, the bacteria, the germs, the food debris, they like to hide in between the teeth, the tight spaces. Those are the areas that your brush misses all the time. So you should make it a point to floss in between your teeth. Aside that, you also need to clean your tongue. I know a lot of people have the habit of not cleaning their tongue. No, you actually need to be cleaning your tongue all the time. You can decide to use your brush to clean your tongue. In cleaning your tongue, you take the brush to the back and you push it forward. Take it to the back and then you push it forward. You don't do it in any haphazard manner. No, you take it to the back and then you push it forward. Aside that, as I mentioned earlier, there are some projections of the brush that you can use to clean your tongue. So also turn it, and you can also do it in the proper manner from back to front, so that you don't push the germs in front to the back. That's why you don't brush in any haphazard manner. And if you can invest in getting tongue scrapers. So there are two types. You have the plastic type and you have the metallic type. So with the plastic or metallic type, also goes to the back of your tongue. You don't go all the way to your throat and then you hear some people try to vomit. Yeah, they'll be gagging. No. You don't do that. Make sure you don't go all the way to the back. Do the areas that you can see with your eyes. The parts that are way at the back are self-cleansing, so you don't really need to go all the way to the back. Just take it to where you can see with your eyes. So you take it to the back and you scrape it to the front, take it to the back and you scrape it to the front. All those interested in getting these tongue scrapers, set of 3 tongue scrapers, this and this can also be used, and there's also another one that looks like a spoon. So with this, you actually, let me demonstrate for you to see. You hold the handles like this, you take the back of your tongue and you scrape it forward. Take the back of your tongue and you scrape it forward. So anyone interested in getting these tongue scrapers, I'm going to put a link in the description box. Check it out. You can place an order for these tongue scrapers. Yeah. Okay, so aside scraping the tongue, I'm going to show you how to brush your teeth. When brushing your teeth, you don't brush it in any haphazard manner. And some of you do up and down. Some of you do side and side. You don't do it that way. Ideally, when you're brushing your teeth, you need to tilt the brush upwards, as if you are pointing it towards the gum. You point it towards the gum, and then you brush in tiny circles, and then you push down. Tiny circles, and then you push down. So you angle it towards the gum area, but let part of the brush be on the teeth. So you brush in tiny circles like this, and then you push it down. So you need to do that for all your teeth. When you come to the back, so the inner aspects of your teeth, so these are the inner aspects, the parts that your tongue can easily touch. You try to do the flicking motion to try and clean all those areas nicely. So do the inner aspects of your teeth. When it comes to the inner aspects of the front teeth. You hold the brush like this, you angulate it vertically like this, and then you clean behind your teeth. You do the same thing for the upper, you clean behind your teeth. And when you're done, the chewing surface, the areas you used to chew on your goat and then your aponchakakra, you brush on those surfaces normally like this. You do that for the upper teeth as well, brush on those surfaces. And once you're done, some of you, I know, when you're done brushing your teeth, you wash your mouth with water. No. You don't wash your mouth with water. You spit out the toothpaste, but you don't rinse your mouth with water. Because you need the fluoride in the toothpaste. The fluoride is a chemical that helps to protect your teeth from tooth decay. You need the fluoride to protect your teeth after you're done brushing. So you spit out the toothpaste, but you don't rinse your mouth so that the fluoride can sit on your teeth and protect your teeth from tooth decay. That should be how you brush your teeth. Yeah, so according to the question from Abena, she wanted to know whether you should brush your teeth before eating or after eating. What I advise people is that you need to be brushing twice daily, morning and evening. If you've brushed your teeth the night before and you wake up in the morning, ideally you need to brush again before you eat. But sometimes some people are too lazy to do that. It's advisable that you brush your teeth first thing in the morning because you've slept for about 6 to 8 hours. There's a lot of bacteria moving in the mouth at all times. You have even some few hours after brushing your teeth, plaque starts to form in your mouth. So it's important that when you wake up in the morning, try as much as possible to brush your teeth. And when you're done brushing your teeth and you have something to eat, you don't brush your teeth immediately after eating. No, you need to wait for at least 30 minutes for the saliva in your mouth to reduce the acidity created in your mouth during eating. So when you're eating, there's what we call an acidic challenge. The acidity in your mouth goes up and you need the saliva in your mouth to reduce the acidity. Saliva plays a very important role in our mouth. So it's important that after eating, you wait for at least 30 minutes. After 30 minutes, you can decide to brush your teeth before you head to work. And I'm sure you're asking, Doc, so that 30 minutes, are you trying to say I would have a very bad, I would have bad breath during that period? So what you could do is that you can decide to chew on sugarless gum. Not just any gum, but sugarless gum during that 30 minutes because chewing gum also stimulates your salivary glands to produce saliva so that it can help to reduce the acidity. Or you can even decide to use a cup of water to swish your mouth and swallow. So these are some of the tips that I feel you should know. And even with vomiting, in case you're the type, maybe you're pregnant and when anything you eat, you vomit and you want to brush your teeth immediately, I advise that you wait for at least 30 minutes before you brush your teeth after vomiting. So I hope I answered your question. Guys, keep sending in the questions. Let me read them. Let me try my best to explain it. And I know I've been able to explain this to you, but you should also see your dentist for your dentist advice as well. So guys, just in case you want to schedule an appointment with me, I'm going to place a link in the description box. You can schedule a dental appointment. Come over, let's chit chat. Let me see what problems you have. We can have a thorough discussion, thorough history and examination, see what the problem is, and I'll address that for you at the clinic. So don't forget to hit the subscribe button. Don't forget to like, share the video if you loved it, and it really goes a long way to help me if you keep liking these videos and subscribing to my YouTube channel. So don't forget to, as I said, subscribe. See you in my next episode. Catch you on the flip side.